everyone. Welcome to the first online live pharmacy medication instructional program hosted by Mendel's Clinical Pharmacy. Before we get started, I'm going to read this disclaimer that you see on your screen. The PharmAssist virtual learning experience brought to you by Mendel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mendel's Clinical Pharmacy according to the prescription as written by the provider. So again, everyone, welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mendel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be the Gonolf Ready-Eject Pen, Menipure, and then Progesterone and sesame oil, including interactive question and answers throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. So you either can ask questions on the question and answer or chat function on the Zoom or on the Facebook Live in the comment section. Today we are joined by Roxanne Kennedy. So thank you again for your time and interest this evening. And now I'm going to turn it over to Roxanne.
Hi, everyone. Welcome to our PharmAssist medication learning experience. I'm really excited to teach you guys a little bit about these medications. I've been a reproductive endocrinology nurse since 2010, and I've helped many patients, such as yourselves, along the way, in person over avenues like this, where we can, talk to one another. And during the height of COVID, some patients even had to learn just by, reading it the old-fashioned way and kind of trial and error. So we're happy to be able to bring this to you where we can be interactive and talk to one another a little bit and help to answer any questions you may have. So I'm excited to be able to go through all of this with you. So let's get started with that first video. Hi, everyone. Today we're going to talk about administration of Gonolf. So Gonolf comes in a pen device, looks like this, and Gonolf is FSH, follicle stimulating hormone. So this hormone is a hormone you make in your body every month. You typically have an increase of FSH at the beginning of a menstrual cycle, and that helps to recruit a follicle, and that follicle will hopefully mature and ovulate and may or may not fertilize. But our goal is to create multiple follicles or eggs during an IVF treatment cycle so that we can really optimize your IVF egg extraction. And so we want to give you higher doses of the hormone that you already make in your body every month. And so we can do that using this FSH Gonolf pen. So the first thing you want to do when you get ready to give your Gonolf dose is to make sure that you have a nice clean workspace, wash your hands. You'll often be given some alcohol pads that you can clean the skin, and you can also potentially just use soap and water if you've run out of alcohol pads or didn't have them to begin with. So make sure you have everything clean. And one thing you'll note when you get your medications from the pharmacy is that Gonolf is actually refrigerated. So when you receive your medications from the pharmacy, some things might come in a cooler pack and some things might come outside of the cooler pack, and anything that's in that cooler pack, you always want to put directly into the refrigerator. And so you'll go ahead and grab your Gonolf pen out of that refrigerator. Now, it's up to you if you decide that you want to let that get to room temperature before you give your dose. It's not going to take long for that to happen. But there's, if you're running behind and you want to make sure you get your dose in, within that appropriate window that your physician or nurse has instructed you to do, there's nothing wrong with pulling it directly from the fridge and injecting right away. You do not have to let this get to room temperature. Again, that's just patient preference. So once you do get your Gonolf out, the next thing you want to do is you're going to grab one of these these disposable needles that are going to attach to the end of your Gonolf pen. And you should get multiple of these needles that go along with your Gonolf pen. There's not another alternative that you've gotten in your arsenal that you could use for this. Usually there's 10 or so that come in each pack. And if you ever need more, you always want to make sure that you follow up with the pharmacy to let them know you're running out, or let your nurse know. You should never be reusing needles, especially these disposable ones. So you'll get your Gonolf ready. And the other thing you want to do is note how many units come in your Gonolf pen. So Gonolf comes in several different unit markers. It might come in a 900 unit pen, a 450 unit pen, or a 300 unit pen. And so you just want to make sure that you're always keeping track of this somewhere. Often I'll tell patients to keep this like a checkbook. So be writing down somewhere, today is Tuesday and I'm opening up my 900 unit pen and maybe my dose is 150 units. And that way you're always keeping track of what you started with, what you're using each day. And if your nurse asks you, are you going to have enough medications to get through the weekend? Or you always want to know how much you have in your inventory so that you make sure that you don't run out. So when it's time to give your Gonolf, you're going to get, again, multiple pen devices, depending on how many how much dose you're meant to take each day and how long your medication protocol is going to go for. And again, each dose is a multi-use pen. So, you're not going to be administering, if this is a 900 unit pen, you're not administering 900 units a day. You're going to be using this multiple times. So each time you're not using it, you put it back into the refrigerator until the next day. So your pre-filled Gonolf pen is here and it has all the unit markers at the top. But again, I don't recommend looking at where the liquid is in relation to these hash marks. It's always going to be much easier to tell, especially when you're taking very small increments and small doses of this medication, to be keeping track of it somewhere else. So once you're ready to administer the Gonolf, you're going to peel off the paper backing off the end of your disposable needle. And you want to screw it onto the end until it's nice and tight. Once you get it on there, it's going to have two safety caps. You're going to pull off the first one, set it to the side. Don't throw this away because you are going to need this in a moment. And then you're going to pull off the second safety cap, which is this little tiny blue cap, and exposes your short, friendly, subcutaneous needle for injection. Now, your injection sites for Gonolf are going to go to your lower abdomen or to your outer thigh. So if you're using your lower abdomen, you can kind of think of your abdomen as a happy face. Start on one side and you work your way across. Remember, you'll be injecting potentially multiple shots per day. So you want to make sure that you're using all of the spots that you have on your abdomen and not injecting in the same spot twice. You can start on one side and work your way across. If you're injecting into your outer thigh, you can think about it as the part of your thigh that if you were sitting down closely next to someone, it's the side of the part of your thigh that might be touching that person. So you can use your outer thigh or your abdomen, and you can alternate. You can mix and match. You might put one in your abdomen and another in your thigh. It doesn't matter. Whatever you choose, it's totally up to you. So when you're ready to give your injection, cleanse the site, soap and water or a little alcohol pad, and you're going to pinch the skin. So you're going to pinch the skin and you're going to put the needle straight in all the way down to the hub. Now, I'll often tell patients, and I did forget to mention the most important part, which is actually first to dial in your dose. And that's a really important part about the Gonolf. Before you go ahead and put your needle device in, you do want to dial in your dose. And if you look in the window, and it's kind of hard to see here on the screen, but at home, you'll be able to look in your window and you'll be able to see that you can dial in your dose, and it actually goes in increments of 12 and a half. And so you're going to find your dose. Let's say my dose is 150 units. So I'm going to dial in. And the nice thing about the Gonolf pen is actually you can dial back and forth on this pen. So you might get a little trigger happy and dial past your dose. Not to worry, you can dial back and forth until you get the dose that you need. Once you have that dose locked and loaded in the window, now you're ready to do your injection. So pinch the skin straight in all the way down to the hub. I usually tell my patients that it's a good idea to leave the window facing up so that when you're looking down, when you're doing the injection, you can look down and see, okay, so I'm starting with 150 units or whatever your dose might be. And when you push down on the plunger, it's going to push all of the liquid into your abdomen, into the subcutaneous tissue. And now when you look in the window, you should see 0. And that lets you know that you've given your full dose for that day. Assuming you've zeroed out the pen, now you want to grab the big safety cap that you had on there, and you want to use that to remove the needle that's on the end. If you ever try to put this little guy on the end of it, you are just going to stab yourself in the finger. So best to not use this. Use the big safety cap. You're going to unscrew it. This is going to go in the sharps container, and this is going to go back into the refrigerator until the next day. One thing to mention about the Gonolf is that it actually comes with a little bit of overfill inside each pen. And so oftentimes the manufacturer will say that there's about 75 to 100 units left inside, and that's bonus medication. And as you know, if you've paid out of pocket for these meds, they can be expensive. So it is important to use every last drop that's in here. We talked about how difficult it can be to use these little hash marks to kind of see how much medication is left. So what I recommend you do is, again, mathematically subtract out how much medication you've used versus how much was in the pen to begin with. And when you get to the end, and it seems like mathematically you've zeroed out the pen, if you're due to give your dose for that day, go ahead and ask the pen for whatever you want. You know, you want 150 units, ask the pen for 150 units. It's not going to let you not dial into that dose. It will only administer however much is in there. But again, it's hard to know what's in there, so you may as well ask for what you want. So if I dial into 150, put on my needle onto the end and give my injection. If there's not 150 units inside this pen, the pen will stop at a number other than 0. Whatever number appears in the window is your remainder. That's how much you have left to give. If you find that you're trying to do math and figure out, I dialed in this and now there's this number I needed to subtract, you're doing it wrong. Let the pen guide you. If the 75 appears in the window, that means you have 75 units left to give. So you grab a new pen, you dial into 75, attach your needle onto the end, and give a second shot to complete the dose for that day. So it means some days you might be giving yourself an extra injection, but again, it's important to use up all this medication, especially if you're getting to the end of your treatment cycle. If you have enough medication to kind of eke out a day's worth of medication, then you don't have to grab a new, get to call in for a refill or open up a new pen. So again, the Gonolf is refrigerated in between uses. And so you'll just put the pen cap back onto the end of it, and you're going to stick it back into the refrigerator until the next day when you pull it out and give your next round of injections. So that's Gonolf. It's very straightforward. Again, always important, keep track of what you start with, what you're using, what you have left, so you can always let someone know if you're starting to run out of the injection. So that's your Gonolf injection. I wish you all the best of luck on your journey.
Okay, awesome. You kind of briefly touched base on a lot of points. So the first thing you kind of said was it being cold. So if someone has a question, if it's better to take it out, if they have the time, is it better to give the medication when it's room temperature or cold? If there really isn't a preference, if you can just touch base on that a little bit more.
Yeah, so a lot of patients ask that. I mean, of course, we always want to make sure that you're not administering medications under some crazy time crunch where you've like forgotten to give them and it's a full panic to try to get everything ready. So it is always a good idea to kind of get organized ahead of time. And while you're doing that and preparing your other medications, some of which might require mixing, it's never a bad idea to just grab that Gonolf out of the refrigerator and just kind of let it come to room temperature on your counter. And again, it doesn't take long for that to happen. And some patients actually, would prefer to administer the medication when it's not cold. Some, women are very sensitive to, these medications as they're being administered, and some feel different than others. And so you'll kind of get a sense after that first day of doing your injections, what feels right for you. And if there's, any doubt, don't pull an ice cold, pen out of a refrigerator. Let it come to room temperature first and then go ahead and administer. But just to reiterate, if you don't have time and you do go ahead and administer cold, it does not change the efficacy of that injection.
Perfect. Another thing someone is asking about anything to help with the injection sites. But first time given an injection, it is sub-Q. Do you recommend icing it? Do you recommend just blunt forcing it or easing the way in? What are some tips if someone's never given an injection before?
Yeah, so that's a good question. The first thing that many patients will do, especially if they're maybe a little needle shy or maybe have less subcutaneous tissue than others, is really to ice the site first. And it just, like a minute of icing. It doesn't really need to be a very long time. But it also helps to make the skin a little tauter. And that way, when you're giving the injection, you don't have to work so hard to pinch the skin and to, push so hard on the end of the pen device to actually get the needle to go in. And so icing it is a good way to kind of take the edge off. Another thing I'll tell patients too is that the straighter you put in the needle and the straighter you pull it back out actually helps to minimize bruising. Sometimes, those little bruises will happen just like nick a capillary on the way in or the way out, and sometimes there's nothing you can do about it. But the more, precise you can be about injecting and pulling straight back out, the better. But again, are not a dartboard. There's no reason to be, throwing these injections in as hard as you can. It is a very fine pointed needle, and it's sharp, and it should go, right in with no problem. So, don't feel like you need to really force it in or hurt yourself in order to give this injection.
I totally agree. I tell my patients the first one's always the most scary, but I've given myself injections before, and they really are not as terrifying or painful as it seems. It's kind of getting over that hump of giving yourself an injection.
That's right. Sometimes there's nothing you can do about those shaky hands either, right?
Exactly. Even if you're
done to go.
Time, I was like, next question that that has come in is, how long should patients expect to be on Gonolf, just very typically speaking, in their cycle?
Yeah. So the average patient cycle is somewhere between 10 and 12 days. That's usually what I tell my patients, but you might not be the average person. You might, respond really well to this medication, and you might be ready for egg retrieval sooner than your nurse or physician might have predicted, or your ovaries might take a little bit longer to wake up, and you might be on this medication longer than that average 10 to 12 day time frame. So it's actually very, tends to be clinic specific how long they'll want a patient on these injections before you'll take your trigger shot and go to egg retrieval. Some clinics are, feel very strongly you should, take a certain number of injections before your eggs are really ready. And other clinics will kind of let you stimulate as long as they need to get your eggs to the appropriate size before you're ready for trigger. So if you ever have questions about, gosh, it feels like I'm running out of this medication, or, I was only ordered enough for 10 days, but now I'm going 12 days, is that okay? Talk to your nurse, talk to your physician, and just let them know your concerns. That's what we're here for. And we always want to make sure that you know how you're doing during your treatment cycle, and that you feel confident about moving forward with the egg retrieval process. And it's always important to stay informed and know what the right questions to ask so that you can make sure you have the best outcome.
Very true. I always want my patients to make sure they have a good inventory, and they're updating inventory. So if they are going longer, which isn't a bad thing, that they just make sure they have enough medication for the next dose at least. Exactly. Okay, thanks. All the questions that have come in. Do you have anything else you want to say about the ReadyJect pen before I get us going on our next video?
Yeah, I think that ReadyJect pen is great. It's easy to use. It's one of the ones that, sometimes we'll have patients maybe who aren't doing an IVF cycle, but are maybe, not responding well to tablet medication and need to add in, Follistim or Gonolf or whatever to kind of get things going. And those patients will kind of start on the fly. And I always find that Gonolf is really, the easiest pen to teach people and direct them, watch this quick video, go to the Mandel's link and watch this video. It's just very straightforward and easy to use. And like I said, during the instruction, let the pen guide you. Ask it for what you want. It'll tell you if there's not enough in there. And it's pretty straightforward in that aspect.
No, I totally agree. I think it's very user-friendly pen when doing injections. And yeah, it's just getting over that first one. So perfect. Well, I'll get us going on our next video, which is for Menipure.
Hi, everyone. Today we're going to talk about medication administration for the injection Menipure. So Menipure is a subcutaneous injection. It is made up of FSH, follicle stimulating hormone, and LH, luteinizing hormone. And both of these hormones you make in your body. And typically at the start of a menstrual cycle, these hormones will help to recruit a dominant follicle, and then hopefully that follicle will mature, and that would be the follicle that you ovulate. But during an IVF cycle, what we want to do is try to recruit all of your resting potential antral follicles. And so we can use high doses of this medication, often paired with other injections, to help to really optimize your ovarian response. So today I'm going to show you how to administer Menipure using the Q-cap system. So the Q-cap system is great in that it's a needleless system. You can't inject with it, you can't hurt yourself with it, and it just helps you to move the liquid and the medication around to just help to make that mixing process a little bit easier. So first thing you want to do in preparation for Menipure is to make sure you have a clean workspace, wash your hands, make sure you have some alcohol pads or soap and water ready to clean the site where you're going to be injecting onto your subcutaneous tissue. So you'll need to gather your Menipure, your vial of liquid, and your vial of powder. And today we're going to talk about how to mix up 1 vial of Menipure powder, and 1 vial of Menipure powder is the equivalent of 75 units. Your clinic may instruct you to take more than 1 vial of Menipure powder, and at the end we'll talk about how you can do that. So you'll get your Menipure powder and liquid ready. You're also going to need the Q-cap system, and this actually comes inside the box of Menipure. So typically it's 1 Q-cap, 2 vial of Menipure and liquid powder. And you're going to need an injection needle. Usually it's a 1/2 gauge needle, 30 gauge, 27 gauge, 25 gauge, those are all appropriate. And then you'll need a needle and syringe combination. Sometimes they'll give you just the syringe without this other needle attached. You actually won't need this today, but you'll need a 3 ml syringe to go along with it. So first things first, open up your 3 ml syringe and needle. And you can, if you have a needle attached to the end, you can actually just attach it. It's a whole screw system. So this needle tape comes off, and then you'll just have your syringe ready. And this is what's you're going to pull the Menipure back into this to eventually inject it into your body. The next thing you want to do is you want to grab your Q-cap system. You peel back the paper backing on the end, and these actually you only end up using 1 time. So you should never have to reuse a Q-cap. You should never have to reuse syringes or needles or any of that. You should have a new stock and a new supply for each day. And you want to get your vial of Menipure liquid, your mixing liquid and your Menipure powder ready. So Menipure liquid and the powder here, and the goal is to pull the liquid from the vial and put it on top of the powder so that you can pull it back into your syringe and inject it. When you try to draw from these tiny little vials, there's actually a vacuum effect. So as you're trying to draw out, the vacuum inside the little vial is trying to suck it back in. And so the best way to negate that vacuum effect is actually to first insert some air inside the vial, and that will help you to draw out your medication. So you want to get your Q-cap ready, and we've changed the packaging. Sometimes it's a little difficult to get out, but you're going to pop out that Q-cap and you're going to attach it to the end. So again, this is your Q-cap needleless system. Can't inject with it, can't hurt myself with it. It's just going to help me to move everything around. So the first thing you want to do is you want to draw back with some air and put some air into your syringe. Now, when you're mixing up Menipure, they give you 2 milliliters of mixing liquid of normal saline, but you actually only need 1 milliliter of liquid. Mixing it all together with 2 milliliters just gives you more volume than you need to inject. So you always want to make sure you pull back out only 1 milliliter per liquid when you're injecting 1 vial of Menipure powder. So if you want 1 milliliter of liquid, put 1 milliliter of air inside your syringe. Snap it on top your vial of liquid. Push the air down inside. Keep your thumb on the end of the syringe, and that helps to minimize air bubbles when you pull it back. Flip the whole thing upside down and let go. And you can see how it starts to now push back out the liquid. It's not going to ever give you exactly what you need. You'll still often need to pull back on their end of the plunger and manipulate that. And you can push back anything you don't need, including any air bubbles. By the way, don't get caught up with air bubbles. Remember, you're injecting into skin, not veins. So those little tiny air bubbles actually don't make too much of a difference. But if you have some in there, you can flick them to the top and push them back inside the vial. So once you have your 1 milliliter of mixing liquid, you're going to pull the vial of saline off the end, and you're going to grab your vial of powder. And now you're just going to repeat the process. So before you put air on top of liquid, now you're putting liquid on top of powder. So snap it on top. Push that liquid down, and that Menipure powder should dissolve almost instantly. So you can swirl it around if you need to help it, but you don't need to go crazy with shaking it. It should dissolve pretty quickly, and then you're going to flip it back upside down and pull it back out. So at this point, every drop of liquid that you put into that vial of Menipure powder is your medication. Maybe you couldn't see as well, and maybe you put a little bit less than 1 ml or a little bit more than 1 milliliter. It's all medication at this point, and you want to make sure you pull it all back out. Because most of this vial is covered by a sticker, sometimes it can be hard to see what's left inside. So I always advise my patients to pull back until you see an air bubble form at the top of your syringe. That lets you know you've pulled everything back. There's nothing left to pull. Remember, you can always push that air bubble back out through the top of your needle later. Once you have your full dose, you're actually going to unscrew this whole thing. Remember, you can't inject with that Q-cap system. You don't need it anymore. Now what you want to do is grab your subcutaneous needle for injection. So I have my short subcutaneous injection needle, and I'm just going to screw it onto the end. Pop the top off the cap off the top. And now remember, I have an air bubble on the top. So I'm just going to push it up until I see a little drop of liquid come up through the top. And now I know my needle is primed and ready to go. Subcutaneous injection sites. These injections are going to go anywhere below the belly button line. So if you think of your abdomen like a happy face, you start on one side and kind of work your way across. Remember, you're doing multiple injections a day often. And so you always want to make sure that you're using all the real estate in your abdomen. The other site markings would be on the outer portion of your thigh, that when you would sit down next to someone, if you were sitting closely, it's the outer portion where your leg might touch that other person's leg. So if we're injecting into our belly, what you want to do is you want to pinch the skin, and you want to put the needle straight in all the way down to the hub. Once the needle is all the way in, you're going to release your pinch, and you're just going to push down on the end of the plunger until there's no more liquid to inject. You pull straight out. And the next thing you want to do once you're done with your injection is to safely put the cap back on the end of your needle so that you don't stick yourself. Your clinic should hopefully, or the pharmacy will hopefully provide you with a sharps container. And so sometimes those get filled up quickly, especially if you're using multiple injections. So if you unscrew it, the needle itself goes into the sharps container, and this is actually just trash. This can go into the regular trash bin. So this would go into the sharps container, and you'd be done with your Menipure injection for that day. Now, if your clinic advises you to be using more than one vial of Menipure per day, you might be instructed to use 2 or 3 or even up to 4 vials of Menipure a day. It doesn't mean that you need to give them all in separate injections. You can actually combine multiple powders together into the same 1 milliliter of liquid. You're just further concentrating down that dose so that you're just still only giving yourself 1 injection. The lead up to that process is the same. You're still going to pull out your 1 milliliter of mixing liquid, put it on top of the first vial of powder. But instead of twisting that Q cap off and putting on your needle and injecting, you're just going to pull the Q cap off the end. Now you still have it. It's still attached to the end of your syringe. And you would move on and grab a second vial of Menipure powder and repeat the process. Shoot it on top, push it down, shake it around a little bit, turn it upside down, and draw back out. Now you'd be pulling back the same volume. Remember, you didn't add any more liquid. It's still 1 milliliter of liquid, but you've added more powder to it. So this is now 2 vials of Menipure powder, or 150 units in 1 milliliter of liquid. If that's the dose you're meant to take, then again, your job is done. Twist the end of the syringe off, put your needle on, and do your injection, just like demonstrated before. If you're instructed to take 3 vials of Menipure, same concept. You just add that same volume onto the third, or even a fourth if that's what your dosing instructions call for. Either way, once you're done with your mixing up your dose, if there's none left, you're now going to go ahead and discard all of your vials of Menipure powder and liquid, and your Q cap and your needles and syringes, and you'll get a whole new setup for the next day. So that's your Menipure mixing and administration, and we hope that you'll do great, and we wish you luck along your journey.
Okay, awesome. First question is there a certain time of day that patients should be taking their Menipure? And also, do they need to be consistent when taking their Menipure on a day-to-day basis?
So that's a good question. So the time that you're meant to take your injections is, the answer to that question is whenever your clinic tells you to take your injections. There are some protocols that require patients to take medications twice a day, once in the morning and once at night. And there's some protocols that require patients to take their injections just once at night. Again, it's clinic specific, it's physician specific. And you might decide, that you need to follow up with your practitioner just to make sure that you know what your time of day is. But typically what I'll tell my patients, especially if they're just administering in the evening, is to pick a time, be consistent, but you can give yourself, up to an hour on either side of that dose, of that dosing time. We know that we all have busy lives, and sometimes things get in the way, and sometimes it's impossible to be exact on the exact minute that you've given it in the past. And the other thing that comes along with this too is that it's stressful. This whole process is stressful, and if you're stressing yourself out trying to make sure you take your injection every day at 8:05 p.m., you're going to make yourself crazy. So stress can have adverse effects on all this process. So give yourself a break. Try to be as consistent as possible with at least the window that you picked. Make sure that you know whether you're meant to take your injections just once a night or twice a day, and make sure that you're, consistent with that, and that sometimes it's helpful even to set an alarm for yourself, so that you can remind yourself, oh, my time's coming up. I need to get my injections ready and all pulled up, so that you can just kind of be more zen when it's actually time to administer.
No, that's great advice. I tell my patients setting themselves a daily reminder is like in their calendar or however they did, just really does help kind of alleviate the stress and makes it where, because life does get busy, and it kind of makes it easier to remember that they do have these. But also there's so much grace, and doing your medication early or late is never going to ruin anything. So really good advice. Next question, someone says they heard that Menipure can sting, maybe a little bit more than Gonolf. Any tips or tricks to help minimize the burning sensations that can happen with Menipure?
Yeah, so that is a true fact that Menipure does feel different as you're injecting than the other injections do. The reason is that the LH compound that's in the Menipure that's not in your Gonolf, and that can actually cause that burning effect. And so one of the things which we talked about a little bit earlier was icing the spot first. And so icing it can certainly be helpful. It can help to take the edge off. But one thing I'll usually advise patients too is, depending on the amount of subcutaneous tissue you have, like if you're a very small person and there's just not a lot of subcutaneous tissue to grab in your belly, maybe you want to give your Menipure in your thigh, and that might actually help to alleviate that burning effect. If you like giving your other injections in your belly, you can do all those in your belly and then just save the thigh for that. But one thing to note is not to panic. Now you know that sometimes that Menipure can have a different feeling than the other ones do. And so when you start to administer that injection, if you feel that burning effect, don't freak out and pull the whole thing out. Know that it's happening. Know that it's self-limiting. Once you're done injecting, that burning sensation should stop, and it shouldn't be anything that's painful. It's just like, oh, that feels a little different than the other ones do. So be aware of it. Do the little tricks that we talked about, icing, maybe switching up the injection spot, and you'll be fine.
Great tips. Next question is how to store Menipure. So someone heard that it needs to be in the fridge. Then another patient said that she's left hers out. How should patients store their Menipure before giving a dose, or why, before they start their medication?
Yeah, so Menipure is actually meant to just be kept at room temperature. So one less thing to have to worry about and clog up your refrigerator with. So you can keep it at room temperature. You can keep it out with your needles and syringes, and have that one just kind of ready, and nothing in advance that you need to think about to pull that out and get it ready ahead of time. It's, I have had patients over the years who just get very overwhelmed when they get their medications, and they just stick all of it in the refrigerator and are just like, okay, it's all in there and it's safe. It's not necessary to keep it in the refrigerator. So they do recommend that you keep that out. And if you've done that, if you've stuck it all into the refrigerator, go ahead and just pull your Menipure out now. The only thing that really needs to be in there is Gonolf. And if there are any other injections that we haven't touched on today, you can actually look at the stickers that come along with it, or contact your nurse to see if anything else that you're using might need to be refrigerated.
Perfect. And then just like you said, if it was in the fridge, didn't ruin the medication, but yeah, it can just be left out on that counter. Another question is, someone said that their friend who's doing infertility treatment is just on Gonolf, and she is on Gonolf and Menipure. Is that a bad thing, or why would she be on both medications?
Yeah, so again, a lot of the decisions about your protocol and the medications that you're taking are clinic specific, and it's not necessarily right or wrong. Every time your physician comes up with a protocol, they're always taking you and your fertility history into account. The physicians look at things like AMH and egg reserve and BMI and, past success or failures with treatment cycles to help to make these decisions. And so, the old saying, there's no wrong way to skin a cat, the same is true for the fertility treatment protocols. And so your physician has likely chosen the protocol that they tend to see the best outcome with, and the one that makes the most sense for you. So it's always really important, as we always talk about, we want to make sure that you do have a fertility buddy during this process. It can be isolating to kind of go through it alone, and it's helpful to be able to find someone that understands your journey and that you can talk to and bounce ideas off of. But it is really important to be careful not to compare yourself with that person and expect that you're going to do the exact same things at the exact same time and have the same response. You're different people, and your fertility story is not the same. And so trust that the medications that you're on are what is right for you.
I think that is such a good point. I tell my patients all the time, not any patient's the same. And even if you unfortunately have to do multiple cycles, then your cycles aren't going to be the same. And that is okay, that we make adjustments and things. And it is definitely so great to have support systems, but to always ask your doctor or your nurse if you have questions, or talk to your healthcare provider with those, because sometimes you compare and play the comparison game, and that can sometimes go down a kind of a dark path that you don't want to go down.
Yeah, those rabbit holes. Yeah.
Yes, very much so. But I think that is all the questions that I have right now. If you have anything else left to say on the Menipure, if not, I can get our next video going.
Yeah, let's get it going. There, today we're going to talk about progesterone in sesame oil injections. Progesterone is a medication that's used in most IVF cycles and many frozen embryo transfer cycles. And this is the medication that's actually going to help to support a pregnancy until your placenta takes over. And so this medication is very important. And this medication is also can tend to be somewhat daunting for some patients, in that it is one of the injections that will be administered intramuscularly. And the site for your intramuscular injections is going to be the upper outer quadrant of your butt. That is the only site that we recommend for these injections. Remember that this injection is mixed in sesame oil, which is a pretty thick substance. And so we always want to make sure that you're injecting it into the right spot. And most clinics across the board will advise you to administer this medication to the upper outer quadrant of your butt. So it's possible for you to have someone else administer this medication, but there's also lots of patients who end up doing these injections on their own and like the control of doing it on their own. So I can show you two ways for doing this injection, whether someone else is administering or whether you're going to be giving it to yourself. But the first thing you want to do when you're getting your progesterone injections ready, you're first going to need your vial of progesterone. And again, progesterone is mixed in sesame oil. This medication is not meant to be refrigerated. It is meant to be kept at room temperature. And you are also going to need a syringe. Usually your dose of progesterone might be 1 milliliter, but again, it depends on your clinic. Sometimes it's more, sometimes it's less. It's often patient specific. You're going to need an 18 gauge, 1.5 inch needle. That's going to be your mixing needle. And again, this needle, although it's big and thick, it is the best needle for drawing up progesterone because that progesterone is so thick that it does come out nicely with this big syringe, big needle. And then when it's time for your injection, you're going to change over to the 22 gauge, 1.5 inch needle. Now, this is the injection needle. A lot of people worry, why is it so big? Why is it so long? Do I really have to inject that whole syringe, that whole needle into my body? The answer is yes. The reason why the needle is as long as it is that it's not being injected into the subcutaneous tissue like some of your other medications were. This one actually needs to access the muscle, and that's where the progesterone is best absorbed. And so that is the reason for the length of this needle. And so the first thing you want to do is grab your vial of progesterone. And one thing to note about progesterone, it's actually a multi-use vial. Anytime you're dipping into a multi-use vial, multi-use means you're not going to use this vial for just one injection. It's actually going to be for several injections. You always want to clean the top of the vial with a little alcohol pad, and that just makes sure that you keep it clean, prevents infection. So you're going to pop the top off the cap, pop the cap off the top, rather, if this is the first time that you're doing these injections. The cap does doesn't go back on. So that's part of the reason why you want to use the alcohol pads, because it's not going to be something that you can snap on and off. It comes off one time, and that rubber stopper prevents the liquid from coming out. And so you'll just always want to make sure you use an alcohol pad to clean it off every time you dip into it. So this is the first time I've opened up my vial of progesterone. I can use an alcohol pad just to be safe. Open up your alcohol swab, and you're going to clean off the top. So you'll want to get your syringe and needle ready. Sometimes they're connected and attached together, and sometimes they're not. This one is not. This is a 1 milliliter syringe here, and I'm going to attach it to the end of my 18 gauge 1.5 inch needle. So I'm going to go ahead and show you how to drop 1 milliliter of mixing of the progesterone today. And again, your dose is going to be dependent on what your clinic advises you to do. So you're going to want to put your 18 gauge right into the top of that rubber stopper and flip the whole thing upside down. Pull back on the end of the plunger, and you should see your syringe start to fill up with liquid. Once you fill up, again, you can manipulate this, and sometimes it comes out slow. Again, it's oil, so don't expect for it to pull back as quickly as it might with some of your other mixing medications. But you can manipulate. You can push back on the plunger. You can pull back until you get exactly what you need. And you want to pull back until your rubber stopper, the top of your rubber stopper, lines up with the 1 milliliter mark. My syringe is continuing to fill up with the liquid. It's going pretty slowly, and that's okay. We'll let it continue filling up. Again, I'm going to keep manipulating it until I get exactly what I need. And once I have my 1 milliliter of progesterone, I'm going to be ready for my injection. I'm going to pull the needle out. Again, this is multi-use, so don't throw it away. You want to put it in a safe place. It is meant to be kept at room temperature. I'm going to safely put the cap back onto the end of my 18 gauge needle, and I'm going to remove it. And I'm going to put my 22 gauge 1.5 inch injection needle onto the end. So again, progesterone is meant to be administered to the upper outer quadrant of your butt. The timing of progesterone is pretty important. Your clinic might specify that you're meant to take your progesterone injections always in the morning or always in the evening. Usually they'll give you a 3 to 4 hour window for injection. It's important to try to stick within that window, just to make sure that you're keeping a steady stream of progesterone in your body. So upper outer quadrant of your butt, you're going to find your site markings. So if you put your hand on your hip and you drop your thumb about 1 inch to 1.5 inches, it is the very top most upper outer quadrant of your butt. Another way to visualize this is to kind of think about like where the tag on your jeans might be, and you would go all the way to one side or all the way to the other side. The new recommendations are that it should almost feel like it's going in your hip. You want to be avoiding the sciatic nerve, which runs right down the middle of each of your butt cheeks, and you don't want to hit that. That will be very painful. So you're going to go up and out of the way. You should be able to usually just glance over and see where those injections are going. And a really good thing to do is to ask your nurse to actually take a Sharpie, draw some circles on your butt, and that way you know you're going in the right spot each time. So if someone else is going to be administering this injection for you, again, you'll have your site already marked out, and it's a good idea. You want to stand up and you want to lean forward on a hard surface. And that way you can take the weight off of the leg and the butt cheek that you're injecting into. And that way it's not a tense muscle. So you're going to relax on that side. And the person who's doing the injection is going to, instead of pinching like we might with some of our other injections that are subcutaneous, now we want to spread the skin. So they're going to take their hands, they're going to spread the skin to stabilize it. And they're going to take the cap off the end. You can always use an alcohol pad to cleanse the site, again, or just soap and water. You're going to spread the site. The needle is going to go straight in all the way down to the hub. Once the needle is injected all the way, they can release this hand and use it to stabilize the syringe. Now what you want to do is you want to pull back a tiny bit on the plunger, checking for blood return. You just want to make sure you're not about to inject into a little vessel or something that might cause a big bruise. If you see your syringe fill up with blood, then you know you're in the wrong spot. You want to pull the whole thing out and you're going to inject into the opposite side. This, by the way, will not likely happen. Most patients, especially if you're going in the right spot, it's rare that your syringe would fill up with blood like that. And so assuming you don't see that, you're just going to go ahead and push straight in, push the liquid all the way in. Now, again, because this is mixed in oil, it doesn't go in as fast as some of the other injections might. And that's probably okay. Some patients don't want to have all of that oil pushed into the muscle, in a really fast way. So it's fine if it just kind of goes in at the pace that it's going to go in. You can instruct the person that's doing your injection to either go faster or slower if possible. Once the injection is all the way in, there's no more medication to administer. You pull straight out. Again, put the safety cap back on the end so that you don't stab yourself. And you can separate the syringe from the needle. So not all of this has to go into the sharps container. The needle can be separated and this can be placed into the sharps container. And this is just regular trash. This can go into the regular trash can. Now, if you are going to be administering this injection yourself, I always recommend that you get someone, the nurse, preferably in your clinic, to go ahead and take a Sharpie, draw some circles on your butt. That way, you know exactly where your injections are going. If you were to try to stand up and use a mirror and try to figure out where this is going to go, you're going to be putting in all kinds of crazy places. So it's a better idea to sit down and cross your leg one over the other. And if you lean over and you look for your injection site, again, you should be able to see it. You'll be able to see within the circle. You're just going to put the needle straight in, all the way in to the end of the plunger. And when you're using your dominant hand, you can actually go ahead and pull back a little bit on the plunger and check for blood return and inject. If it's ever with your non-dominant hand, sometimes it's hard to manipulate the plunger like that. So as long as you're going within the correct injection site, your chances of getting it wrong are slim to none. But it's really important. One thing to know is that you want to alternate each day. So you're going to go on the right side one day and on the left side the next day, and go back and forth and back and forth. And that way you're not fatiguing that muscle. Another trick is to take your hand after you do the injection. You're going to massage the injection site, help that oil to really get into the muscle. Walking around for a little bit afterwards also gets the muscle moving and helps that medication to absorb. And a lot of patients will end up using a heating pad. So usually we recommend using heat rather than ice when you're trying to get the oil to absorb into the muscle. And so a heating pad, whether it's one that you plug into the wall and sit on for 20 minutes, or they even make those, those little heat packs that you kind of snap and put on your butt and go about your life. Either way is totally fine, but it helps, really helps take the edge off and helps with that progesterone to absorb into the muscle. Progesterone is one of those medications that you're going to be on for kind of a long haul. Again, it's a really important injection. That medication is the lifeblood of the baby. And so you want to make sure that you're continuing it until your physician gives you instructions to stop taking it. Some clinics will even have you do a tapering of that medication, or some will just have you stop it altogether. It's all just dependent on the clinic, so just make sure you follow along with those instructions. Those are your instructions for mixing up progesterone, and best of luck on the journey.
Okay, beautiful. So the first question that I have is, you kind of touched base on it a little bit, but you know, you're going to be on it for a while. But this patient said that she's heard that she's got knots from the progesterone oil from after her injections that are kind of hurting her. Any tips for those to help with those knots or this discomfort of the progesterone oil injection?
Yeah, so unfortunately, knots can be somewhat common, and some people are just kind of prone to them, and other patients will give 8 weeks of injections, and you'd never know they ever put a needle in their butt. So it's kind of funny how patients can respond to this medication. But one of the things that you want to do, which I did talk about a little bit, the very first thing you want to do after you give your injection is just take your hand and massage the site. And that really helps to help that oil to thin out and get into the muscle. And then heat is also a really good option to kind of help that oil to thin out, and can also be helpful with knots. But one thing I will say, because my patients call me all the time, I've got a knot, and what should I do? I give them two options. Number one is to take a picture of their butt so that I can see their injection sites and make sure that they're going in the right spot, because more often than not, there's some wiggle room. If there's a big knot there, like maybe we can move an inch to the right or to the left or up or down, or, and kind of be able to get away from that knot so that it's not so painful. And the other option is to actually come into the clinic so that we can really reassess. We want to make sure that there's nothing else going on, and if it's just a knot because there's just oil buildup under the muscle, that's one thing. But if it's something else, we can certainly assess that into the clinic. And so it's just really important to, make sure that you're touching base with someone and knowing that you're going in the right spots. And we're always happy to redraw, Sharpie circles on your butt and make sure that you're given those injections in the right place, because we don't want you to be in pain and be uncomfortable from these, especially because you do have to take them for so long.
No, I think that's great. One thing I always tell my patients too is just making sure that they're putting their needle all the way in to where it hits the hub. Even though it's a bigger needle, it can be scary. Sometimes I feel like they don't go all the way in, and then that oil gets caught between the skin and the muscle, and that's what kind of can cause that too. And also, I think I always tell my patients to do it in the morning and then take like a shower, like set a heat pack, because really that warm compress or water will help kind of disperse that oil, which I know you can touch base on.
Yeah, that's a good idea.
Yeah. Okay. Next question is, what should a patient do if she accidentally missed a dose of her Progesterone oil?
Yeah, so this does happen. I get lots of panicky messages from patients who it just gets away from them. My advice to patients, if my patients call me and ask me what to do, it's take it right away. Take your injection, whatever you're doing, stop what you're doing, take your injection. It's really important to not miss a dose. But of course, I would advise, if you're not my patient, call your nurse and make sure that you touch base with your nurse or your doctor and let them know. They might have a different protocol to follow for that, but typically the answer is take it. Go ahead and take it regardless of what time it is, so that you can make sure you get that dose in.
No, great. Next question that we have is this the oil injections, is it better than a suppository? Is there a big difference? Some patients are on both of them. Can you kind of touch base on why a patient might be on oil versus the suppository, or what's your professional opinion on which one's better?
Yeah, so this is the debate. I start getting asked these questions before patients even start their treatment cycle. I think there's just a lot of anxiety around these intramuscular injections. And so number one, to address, which is better. I think that there's a lot of what we do in the repro world that it's like, that's just what we've always done. Like, we're going to keep doing it this way because that's the way that it works. And that's the way that, we can swear by. And so a lot of times clinics will kind of use that reasoning as to why they want to do things. But anecdotally, what we find is that when patients are using the vaginal suppositories versus the intramuscular injections, that it does tend to actually cause more anxiety than you think it would. Number one, I find that patients, especially in early pregnancy, you kind of have these, cramping sensations in your uterus anyways, as the smooth muscle of your uterus grows and expands to accommodate the growing baby. And so sometimes when you're using vaginal suppositories, we find that, the half-life of that medication is a little bit shorter, and it can cause some more cramping. And it can also cause, cervical and vaginal irritation. And sometimes those patients might experience spotting, where spotting can often be normal in early pregnancy. This just kind of tends to exacerbate things. And so usually my advice to patients is to just try to stick it out with the intramuscular injections as long as possible. One of the other things that I notice that we're able to see is that the progesterone and oil, the injections, you can actually, give an injection and then get a readout when you draw someone's blood as to how they've absorbed and they're processing that medication. And so we, usually have a threshold as to, what's an appropriate progesterone number to see. And we don't often see that with the vaginal suppositories, only because they're absorbed right at the source rather than systemically. So someone might be having perfectly appropriate progesterone levels with the vaginal suppositories. It's just you can't see it when you're drawing their blood and checking their levels. And that can cause anxiety. You know, people are freaking out, like they've been on these message boards and they know what an appropriate progesterone level is, and their number isn't there. And, you know, so sometimes, you know, it can, you think you're kind of like, oh, well, I just won't do these injections and I just won't have to worry about it. But sometimes you're kind of adding in, you know, more worry that's unnecessary. But I will speak also to patients who are on both. And I do find that there's, you know, maybe a very small percentage of patients every year where we start them on the intramuscular injections, and that dose even sometimes will increase the dose and we're still not seeing the numbers where we want them to be. And so we'll often use the vaginal suppositories as an adjunct. So, you know, to help to supplement that. So they might take their intramuscular dose of progesterone in the morning and then use a suppository at night. That way they're not having to wait so long to get their next, you know, kind of kick of progesterone, that they can help to keep a steadier stream of progesterone. And so some patients do use both.
No, that was great. Thanks for touching base on that. And then again, kind of goes back to our previous saying, is everyone is so different. Your physician may add things in or take things away, or you're going to be on it. So just know if you're type A, this is going to be kind of how to let go of some control. So thanks for touching base on that. Another question is how to store the progesterone oil. Fridge, out, leave it out. Or and also someone in the blog, they just wrote that they heard you can put the oil in hot water to thin out the oil, and if they could do that.
Yeah. So two parts to that question. Number one, how does one store progesterone in oil? So it's actually just meant to be stored at room temperature, so you can leave it out on your counter. You wouldn't put your olive oil in your refrigerator. You know, if you kind of think about, like, if you ever make fresh salad dressing or something and you put it in the refrigerator, when it comes out, it's like clumpy and it starts to separate and you have to let it get to room temperature anyways. So always keep your progesterone and oil at room temperature. But yes, it's certainly possible to take that progesterone and oil, take that vial and to put it in like a little tub of hot water. And that does help that progesterone and oil to thin out a little bit. Another thing that patients can do, especially if they just like, sometimes you're giving these shots in the morning and your day might start very early and you're like, I just don't have time to be putting things in, you know, hot water and waiting for the magic to happen. So just taking it and rubbing it between your hands a little bit back and forth can help to warm it up and thin it out and help to make that progesterone injection a little bit more palatable.
No, that's great. And then the last thing is, with the last question I see is there are different types of oil that progesterone can be put in. We discussed progesterone and sesame oil, but can you kind of touch base on the other oils, or if a patient why a patient might be on a different type of oil than the sesame oil?
Yeah. So there are different concoctions of progesterone. The standard is progesterone and sesame oil. It's the most readily available. It's usually the most cost effective. But some patients, and it's funny how it happens, because it's usually after repeated exposure to the progesterone and sesame oil that some patients will actually exhibit a site reaction to the sesame oil compound, and they'll call me and they'll be like, all of a sudden I've got this big welt at my injection site and it's itchy, and what can I do? And sometimes these patients will have done an entire IVF cycle and used it and had no problem, come back for baby number 2. And it's when they're doing their frozen embryo transfer cycle that they develop this reaction. So you can't always predict how it's going to happen. And so when that happens, what we can do is actually prescribe for you progesterone and ethyl oleate, which is just a different compound, doesn't use sesame, and most patients will actually do better than that. So conveniently, Mandel's will compound progesterone and ethyl oleate for you. So if this ever happens to you and you start to develop a site reaction, number one, you can just put something, topical hydrocortisone on there to help with the itching that you're having. Usually Benadryl is safe to take, but don't suffer through this. Let your team know so that they can send in a prescription for the progesterone and ethyl oleate if you need it.
Perfect. That was awesome. Okay, I don't think I have any other questions. Do you have anything else you want to talk about with any of the medications before I kind of close this out?
Yeah, I hope that this was helpful for everyone. I know that it's um sometimes, I mean, even now as COVID restrictions are lifting and hopefully everybody's back in the clinic, so you just might not have that same FaceTime that you're having that you may have had in the past with your nursing team. And so I hope that this was helpful to be able to touch base with a human who does this and can help patients to navigate this journey. And so you guys will do great. I mean, I always tell my patients, as overwhelming as this is, we would not send you home with a big box of needles and syringes and say, good luck, hope for the best, if we didn't think you could do this. You can do this. Expect that your first night of medications is going to be drama. There's often, fumbling around and where does this go? And how do I do that? And oh my God, tears and all the things, totally normal. By the third night, you can have a dinner party and excuse yourself to go to the bathroom and mix up and administer your meds and come back 5 minutes later like it was no big thing. So you definitely got this.
No, I think that is such a good point. Well, thank you so much, Roxanne. You are a wealth of knowledge and we're awesome. And thank you for answering all of our questions. And I want to thank all of our people who joined us via either the Zoom or Facebook. And we hope that you had some questions answered and this kind of helped alleviate some of the stress going forward in a very stressful situation. We do just want to kind of say all these videos are available online on YouTube, on our Facebook page at My Mendel's Clinical Pharmacy /Pharmacist. And we'd like to invite you all next week. We do this again every Monday at 7 p.m. Eastern Standard Time. We do 3 new medications every week. So if you didn't see your medication on tonight, please, or answer your questions, please join us next week. And we hope you all have a great night and a wonderful fertility journey. Take care.